Let's rock, 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 man, rock, gonna rock till we pop, we're gonna rock till we drop, we're gonna rock this town. Rock it inside.
Well, some people deal, unfortunately, with headaches and neck pain every day. You may be one of those folks. And if you have tried everything so far and nothing's worked, our next guest says he's not going to ply you with pills. He's got a natural solution to ease your pain. Dr. Herfindahl joins us to tell us all about it with Kimberly Soliz, one of your patients. Thank you guys for coming in today.
It's a pleasure to be here.
Pleasure to be here. You are really a place where people can go and get relief. And I know a lot of people may say, well, how can chiropractics and how can pressing on certain points of a spine provide relief? And your answer to that is?
What we provide chiropractic care. The big thing about headaches, when people get headaches, incapacitates people. Some people get migraine headaches. Tension headaches can be from the neck. What we do perform chiropractic, which is natural. In terms of how headaches actually happen, is that there's actually your brain doesn't actually feel anything, but there's kind of a sheath around, a membrane around the brain, and around that brain it's called like dura mater, and that dura mater goes from the brain down the spinal cord. Now, what attaches is kind of a bridge between that dura mater and actually the spine. And what I have here is I have a vertebrae, and we actually can kind of see this, where these are the discs, the spinal cord's back here, and the nerves are out. Now, almost all the vertebrae look like this, except for the top ones, number 1 and number 2. And you've kind of heard the Greek mythology, or like Atlas. Well, this is C1, the top vertebrae, and C2 is the next one. And my finger, it'll kind of go over just like this. My finger will represent the spinal cord. So what you can actually have is something called the subluxation, which misaligns that vertebrae and causes that dura mater, which is very, very sensitive to people getting the headaches coming back from the back or in the front or even the eye. And those headaches are so severe that, again, people can't, as far as do anything about them. Now, to give you a little background myself, I am a chiropractor. I've been practicing for 10 years. What brought me to a chiropractor was young when I had headaches. I had headaches so bad that I would almost want to make them harder. Like, I guess it's more of a male thing, macho kind of thing. And eventually, my mom took me to a chiropractor, started getting adjusted, and I stopped having headaches. So I had them as a teenager.
Right, so you knew that this gift could help for other people. And Kimberly, you have benefited so much with, you've had earaches, you've had headaches, and how has Dr. Herfindahl really given you some relief?
Well, just that I don't have any headaches. It's like stress-free. With my job every day, I'm at a computer, and the headaches, just like, from staring at the computer, they're just unbearable. So I go to see Dr. Ashley after work, and he'll adjust me and give me some oxygen treatments.
Now, 7 years ago, you started this, and one thing that you said to me, and I know, ladies, if you're watching, hallelujah, your hands will go up in the air. You said when it comes to that time of the month and PMS, you're symptom-free.
Oh yeah, it's amazing. I can't even explain it. No cramps, no moodiness, and I used to get headaches from that too, but yeah.
Husbands and boyfriends all over the county are trying to find your phone number right now.
My fiance loves him, let me tell you.
I bet. So when people come in, and if they're not experienced with chiropractic care, talk about the different treatments and the pressing, what it feels like, if people have any apprehensions.
Sure. Well, a couple things. I do see kids. I adjusted my daughter when she was 2 days old, so which is very safe and effective. I adjust with my hands. I do adjusting with instruments. We also use things like ice. We do as far as a lot of we do oxygen therapy. You're not going to find that too many places. It's oxygen for the brain, not for the lungs, which most people are familiar with. And it's very light adjusting that we actually do, and very, very safe. And one thing about it is, as far as when people come to see me, we perform a thorough examination, see whether they're a candidate for my type of care. And if they are, we proceed. But the big thing is, I want to educate you too. I want to kind of talk about what we do and how we do it before we actually begin.
I can say that I've had tremendous healing from chiropractic care. And Kimberly, did you ever think, when you've tried everything for your severe headaches, that this could really work?
No, not really, because my family has been to chiropractics before. But when he helped my sister with her back pain and her neck pain and her headaches, it really was like, oh, this actually does work.
And how life-changing for you, you know, not having to suffer with this anymore and just feeling free in your
Yeah.
own body. And Dr. Herfindahl,
Yes.
you really want to pass on
Sure.
the opportunity for
Of
folks
course,
just
yep.
to come and see what it's about. If they've never come to a chiropractor before, if they don't know what it is,
Sure.
you're going to take all the questions and all the scariness out and really make it reasonable for people to see you.
Oh, of course. What we're doing a promotion for the first 7 callers. And what we're doing is where you would come in and do a first initial consultation with me. We kind of talk about your different symptomatology, what's been going on. And then what we'll do is we'll perform a thorough evaluation. We'll do an orthopedic neurological evaluation. We'll do some, as far as 12-point headache kind of testing to see whether or not you get as far as your candidate. Also, too, a lot of cases are, when, especially with people with severe headaches like migraines, there's also the curvature of the spine isn't functioning very well. From a lot of poor posture, sitting at a computer, head being forward, or the new thing is the texting, or head's down, all those different things like that.
Well, we will get everyone to get all that information. It's on our website if you didn't get to write that all down. And thank you so much, Dr. Herfindahl and Kimberly, and just keep feeling great, girl.
Yes,
Thanks
I
so
will.
much,
Pleasure.
you guys.
Thank you.